welcome back to the Deep Dive. Our mission is, well, it's always the same, really. We take a stack of compelling sources, we peel away the complexity, and we try to give you the knowledge you need to be truly well-informed. Today, we're tackling a major clinical story, and this one, it cuts right to the heart of preventative medicine for one of the most vulnerable patient groups on the planet. You probably already know the stakes here. When we talk about patients receiving maintenance hemodialysis, we are talking about a population that faces just staggering health risks.
Yeah.
And cardiovascular disease isn't just a major threat for this group. Tragically, it is the leading cause of death. And historically, for all the complexity of dialysis treatment itself, effective preventative drug therapies, they've been extremely limited. It's just been this persistent clinical gap. Okay, let's unpack this. The big question is, can a simple, readily available nutritional intervention, specifically high-dose fish oil supplements, actually break this cycle?
And I think what's so fascinating here is we're moving the conversation beyond the general population.
Right, where the data on fish oil has always been a little murky.
Right.
Exactly. I mean, the benefits of fish oil, EPA and DHA, they've always been debated, and the findings are so inconsistent. Here, we are focusing squarely on this hypervulnerable group. They have these unique physiological stresses, massive inflammation, mineral imbalances, high vascular strain. All that might make them respond differently. So until now, whether fish oil would translate to meaningful outcomes in a dialysis setting, it was completely unknown, just a massive clinical blind spot.
And the source material we are wading into today provides a pretty definitive answer. We're deep diving into the results of a powerful, large-scale clinical trial published in the New England Journal of Medicine just this month, January 8, 2026. So this isn't exploratory lab work. This is the kind of rigorous, patient-centered data that really shifts clinical guidelines.
And just to build that anticipation right now, the study found an undeniably lower rate of serious cardiovascular events in patients who got the daily 8-3 fatty acid supplement compared to placebo. It's a seismic finding in this field.
Okay, so to truly appreciate the magnitude of that conclusion, we first need to build some confidence in the data. Let's look at the process. This study was the gold standard, a double-blind, randomized, placebo-controlled trial. But let's go beyond just the buzzwords. What does it actually take to run a trial like this in the population that is already managing a life or death routine, 3 times a week?
It takes a monumental logistical effort, really careful design. The scale alone helps ensure the results aren't just, specific to one clinic or one protocol. The trial involved 1,228 adult participants. And they were randomized over a long period, starting way back in November 2013 and finishing up enrollment in July 2019.
Wow, that's a long time.
It is. And critically, this research spanned 26 different sites across 2 different healthcare systems, Canada and Australia.
26 sites across 2 continents. So that immediately addresses any concern that this is just a hyper-specific finding tied to a single specialized unit. But okay, if we're going to rely on this data, we have to trust the method. I know our listeners value the specifics. What exactly was the intervention?
That's such a key detail because with supplements, dosage matters tremendously. The active group received a specific, pretty high daily dose of 4 grams of polyunsaturated fatty acids. And this wasn't just generic fish oil off the shelf, it was a standardized concentration, specifically delivering 1.6 grams of EPA and 0.8 grams of DHA.
Hold on. 4 grams is a significant daily dose. For anyone who's ever struggled with supplements, that presents a real challenge with what we call pill burden. Just the sheer number of capsules and, potential side effects like those fishy burps, which can absolutely undermine compliance. Did they address if patients could actually stick to this?
They absolutely did, and that's a crucial insight we'll circle back to when we talk about safety. But the short answer is yes. They managed adherence really well, which just validates the long-term effectiveness.
Okay.
And the control group, they received a corn oil placebo, looks and feels identical, but, no active NEJM fatty acids. And they tracked these patients for 3.5 years straight.
That's a good amount of time.
It is. It provides enough time for these serious clinical events to actually happen and for the chronic preventative effects to manifest.
That follow-up time is essential. Okay, so let's pivot now to the central question. What do they measure? When you're dealing with a population with such dire risks, the endpoint has to be serious.
And if we connect this to the bigger picture, this research targets the events that truly cause the mortality crisis in these patients. The primary composite endpoint was defined very clearly: all serious cardiovascular events. This composite is like a clinical shotgun blast. It includes everything that causes the most immediate suffering and death.
And they pulled no punches in what counted. We're talking catastrophic events, sudden and non-sudden cardiac death, fatal and non-fatal myocardial infarction, so heart attacks, peripheral vascular disease that leads to amputation, and fatal and non-fatal stroke. That combination it's just the worst possible outcomes for a dialysis patient.
Exactly. And when we talk about statistics that matter, the metric researchers use is the hazard ratio, or HR. It's essentially the likelihood of having one of those terrible events in the treated group compared to the placebo group.
Right, so an HR of 1.0 means no difference.
Correct. And if it's below 1.0, the treatment works. And the further below 1.0 you get, the bigger the benefit.
Okay, so we've established the severe nature of the endpoint. We know the methodology was ironclad. Now let's bring in the main event. Here's where it gets really interesting and, frankly, changes the paradigm. Let's look at the raw numbers.
The difference was stark. I mean, really stark. The rate of serious cardiovascular events in the fish oil group was just 0.31 per 1,000 patient days. A patient day is just a way of measuring the total time the population was observed.
0.31, okay, now contrast that with the placebo group.
The risk exposure there was almost exactly double. It was 0.61 per 1,000 patient days.
So when the researchers ran the final calculation, that resulting hazard ratio was 0.57. Let's make sure that sinks in. An HR of 0.57 means that patients taking the daily fish oil were 43% less likely to suffer a serious cardiovascular event compared to patients taking the corn oil placebo. That is a massive reduction in risk.
And that finding wasn't marginal at all. The statistics behind it were undeniable. The p-value was less than 0.001. In plain English, that means the researchers are saying, we are virtually certain this incredible difference is because of the fish oil, not random chance. This was not a close call. It was a statistically ironclad result.
The power of that overall number is incredible. But the benefit didn't just stop there, did it? The secondary endpoints really confirm the consistency of the effect across different types of events, which helps build a picture of how this might be working.
Precisely. Let's look at the individual components of that composite endpoint. The reductions in these key outcomes were so uniform. They all hovered around that same 43% reduction mark, which really confirms the robustness of the data.
For cardiac death, the reduction was immediate and profound. It showed an HR of 0.55. And for fatal and non-fatal myocardial infarction, the heart attacks we all fear, the HR was almost identical, 0.56.
And even for the complication of peripheral vascular disease leading to amputation, which is just a massive blow to quality of life, the HR was 0.57. These consistent numbers, they just show that the intervention is hitting all the major targets of cardiac and vascular failure that we see with end-stage renal disease.
But let me pull out what I thought was the most surprising nugget of knowledge for you. The largest risk reduction wasn't for heart attacks or cardiac death, which, often grab the headlines. It was for fatal and non-fatal stroke. The researchers found a remarkably low HR of 0.37. Think about that for a second. An HR of 0.37 suggests a reduction of nearly 2/3 of the risk for stroke in this population.
That magnitude it's highly unexpected. And it raises a really crucial question about the mechanism here. We know chronic kidney disease leads to massive inflammation and calcification, but it also creates a prothrombotic state.
Meaning the blood is stickier, more prone to clotting.
Exactly. And a reduction this steep in stroke risk suggests that this 4-gram dose of NEJM fatty acids might be having a disproportionately powerful antithrombotic and maybe even a blood pressure stabilizing effect in this specific patient group.
That's the kind of intellectual depth we need here. It's not just reporting the numbers, it's connecting them back to the pathophysiology. The common wisdom for fish oil often focuses on lowering triglycerides, but a huge stroke reduction like this, it hints at much broader systemic benefits.
I agree. Maybe affecting platelet aggregation or stabilizing those vulnerable, inflamed blood vessel walls you see in long-term dialysis patients.
Absolutely. It suggests the intervention is tackling the hyperinflammation and the proclotting risks that are so unique to the dialysis setting, where blood pressure can just fluctuate wildly during treatment. The fact that they saw such a strong protective effect against so many different vascular events, stroke, MI, peripheral disease, and highly compelling evidence of a systemic vascular stabilization. Now, let's look beyond just the pure cardiac benefit. The researchers also looked at what they call the extended primary endpoint. This expanded the definition to include non-cardiac causes of death. And while the risk reduction was naturally a bit smaller, it still showed a benefit.
Correct. When you incorporate death from any non-cardiac cause, the HR was 0.77. That's still a clear, positive outcome. It implies the supplement isn't just protecting the heart, but maybe contributing to overall systemic resilience in a very frail population.
And if you look at the most comprehensive finding, the one covering a first cardiovascular event or death from any cause, that still showed a meaningful benefit with an HR of 0.73. So the overall prognosis wasn't just slightly better, it was meaningfully systemically improved right across the board. Okay, before we wrap up with the implications, let's robustly address the elephant in the room: implementation and safety. As we discussed, 4 grams daily is a high pill burden. If this causes major side effects, this study, no matter how good the numbers are, is clinically useless.
That is such a critical point for any long-term therapy. And the good news is the researchers tracked adherence and adverse events very rigorously. They found that adherence to the trial regimen and the incidence of adverse events, well, they did not differ meaningfully between the fish oil group and the placebo group.
Wow.
This is a tremendous result for clinical practice. It strongly suggests that the 4-gram dose is well tolerated, even in this sensitive population. They weren't seeing major increases in bleeding events, which is sometimes a theoretical concern, nor were they struggling with patient dropout from, GI side effects.
So this raises an important question then about adoption. Given the severity of the problem, the leading cause of death, and the relative simplicity of the solution, an affordable daily oral supplement, how quickly will this evidence move from the journal pages to routine clinical practice?
That is the challenge now, isn't it? You have definitive, high-level, gold standard evidence supporting a major reduction in mortality risk. The barrier to entry is low. It's not some expensive new drug requiring complicated infusions. It's a supplement. The speed of adoption will be crucial because this evidence should fundamentally change the standard of preventative care for every single patient undergoing maintenance hemodialysis. This isn't just theory anymore. This is a clear, actionable public health strategy.
So let's bring it all together. What does this study mean for you and for the clinical landscape? Based on this large, rigorous, and well-tolerated study, daily no-3 fatty acid supplementation is now established as an effective preventative therapy for serious cardiovascular events in patients on hemodialysis. This isn't a marginal tweak to risk. This is a measurable, clinically significant difference, a halving of major cardiovascular risks using a straightforward supplement. It's the kind of clear, positive finding that medical professionals dream of delivering to their high-risk patients.
And here is a final provocative thought for you to consider. The sheer consistency and the significance of the reduction across such diverse endpoints, cardiac death, heart attack, amputation, and that shocking stroke reduction, it all suggests something really profound. It raises the thought of how this specific 4-gram dose of EPA and DHA might be simultaneously influencing multiple systemic pathways in these high-risk, chronically inflamed patients. It appears to act not just as a single target drug, but as a powerful systemic stabilizer. It seems to achieve a broad protection that goes far beyond any single anti-inflammatory or anti-clotting intervention we've previously considered. It just makes you realize the complexity of the systems being managed by this seemingly simple supplement and the necessity of defining that precise dosing for maximum effect.